that we've got about 4 products, COVID-19 products that have been authorized for use in South Africa, but currently we have 2 that are rolled out. So what happens is that there's a careful and ongoing review of data. So we receive data from the pharmaceutical companies based on the clinical trials that have been performed, and we carefully review this data. And as you may be aware, we also look after the clinical trials that are being conducted. So it basically starts with clinical trials, monitoring of the safety from the clinical trial, then furthermore, careful and ongoing review of dossier. That is the data that is being submitted by the applicant. Basically, the applicant, we're talking to pharmaceutical companies. So as they continuously provide us with the data, we review this data to ensure that it's of acceptable safety, quality, and efficacy. And then furthermore, we impose licensing conditions, including safety monitoring. So for example, we ensure that these companies, as they submit these products for registration, we need to ensure that they've got safety monitoring systems in place for collection of adverse events following immunization, reporting to SABRA, compliance with audits. So those are some of the conditions that are being imposed. And then furthermore, ensuring that any issue, that safety issue that may come along, then they need to update or inform SABRA as soon as they become aware of that safety issue. And then regulatory requirements for reporting all emerging safety issues in a timely manner as highlighted. So except the careful and ongoing review of the safety data, then what else are we doing as the regulator to ensure that the COVID-19 vaccines that we're providing to South Africans are safe? We are active and a full member of the World Health Organization Program for International Drug Monitoring. And this has actually been since 1992. So this has been continuing, and then even today we are still part of it. So being part of the WHO Program for International Drug Monitoring, basically it means that we receive all the safety signals that maybe WHO, they might have identified. And furthermore, we provide all the adverse events following immunization information that we receive to this program. And then what they do is that on an international basis with all other adverse events from different countries, they review the data and look at the safety signals. This is because now the data is large compared to only one country's data. Then they've got a combination of different countries' data, and based on that data that is combined, which nowadays is called big data, then it's easy to identify if there's any safety issues with the vaccines, and they will alert each and every country about that. And then furthermore, we continuously review international literature, safety databases, and any regulatory decisions that have been made by other regulatory authorities. For instance, FDA previously, I think in April, they identified some thrombosis issues, and that was communicated in South Africa, and then we put the study on hold, the rollout on hold rather, because of those safety conditions, those safety concerns that were identified, and then further review the safety of the product and find that the benefit risk profile was still favorable. And then furthermore, what we do, we encourage reporting of suspected adverse reactions and adverse events following immunization in South Africa. And there are different modalities that have been put in place to support and encourage AFI reporting, particularly now that we've got COVID-19 vaccines that are being rolled out throughout the country. I will talk to this issue on the next slide. And then furthermore, we conduct risk-benefit assessment of health products as new information arises. And what's important is that we keep our healthcare professionals in the country and the public abreast of the new safety issues that have arisen. And then furthermore, what's important is that we collaborate with the expanded program on immunization, which is the EPI, to support the collection and processing of adverse events following immunization. And I believe Prof will be touching more on the EPI side of things. But what's important is that SABRA, it collaborates with the EPI and the National Department of Health to support collection of adverse events following immunization. And as well, we are part of the National Immunization Safety Expert Committee, but only on an observer status. So we ensure that processes are followed in order for causality assessment to be done, and Prof will be touching more on that as well. And we promote AFI reporting. So through the AFI reporting, we have launched the MedSafety app, which I'm going to talk to on the next page. And then lastly, what we do, we keep the public informed. So how do we keep the public informed? Number one, we've got press release that we issue as and when new information becomes available. And then furthermore, we publish our Dear Healthcare Professional letters on the SABRA website, and it's accessible to everybody in the country for more information with regards to the new information that have become available. And then lastly, we will be launching what we call a microsite on adverse events following immunization this coming Friday. On all adverse events following immunization that have, on the reports of adverse events following immunization that have been received by SABRA so far, and so that we can keep the public informed. So with regards to the MedSafety app, this is just it's a two-way information sharing tool, which we use for promoting reporting in South Africa. And it can be used both by healthcare professionals and the public. So this, we found it to be a convenient way of reporting adverse events following immunization, but not only that, as well as adverse events for any other medication that one may be using. And it's available on the latest Apple Store and also on the Google Play for Android phones. So what's important about it is that it's customized to provide medicine safety news from the regulator, which is SABRA. And furthermore, it creates awareness of medicines and their potential adverse events to the public. So this was launched in April 2021. So this is a tool that we are promoting in terms of reporting, and we're saying, South Africans, please download this app so that you can start using it and report adverse events following immunization and adverse drug reactions. So regulatory decisions that have been made so far to support vaccine safety, I just provided one example that I touched on earlier, whereby the vaccine-induced thrombosis and thrombocytopenia, basically thrombosis, where we've got blood clotting issues, was identified in the Sisonke rollout. And from the regulator side, we saw this to be a very important safety issue that needed immediate attention. What decision did we make? We paused the study, the rollout rather, and then what did we do after we paused the rollout? We reviewed the available data concerning this safety issue. And after reviewing this, then we realized that the benefits still outweighed the risk. And then instead, what we did, we put measures in place for screening and monitoring of participants that may be at risk for this particular safety issue. And then furthermore, we updated the participant information sheet so that people may be aware of the safety issue. And then we continued with the vaccine rollout. So this is an example of a safety measure that SABRA put in place to support the safety of vaccines. And then furthermore, we issued and published Dear Healthcare Professional letters to healthcare professionals throughout the country, and also published on the SABRA website so that the public can have access to it. And furthermore, SABRA issued a press release to inform everyone. So what are the key messages that we need to take with regards to the safety of COVID-19 vaccines? So what's important is that monitoring of safety of COVID-19 vaccines and communicating any risk, it's a critical priority for SABRA. So we do not compromise when it comes to monitoring safety and communicating these safety issues. And we have put several activities in place, as I've highlighted. And what's important to note is that the serious AFIs are extremely very rare for the COVID-19 vaccines based on the currently available evidence. And most of the AFIs that we have received in the system, they are non-serious, and they are mild. Examples, we're talking to headache, pain, and redness at the injection site, fever and chills. Those are the ones that are mostly received in the system. So we further say SABRA continuously monitor and inform healthcare professionals and the public about the up-to-date safety profile of the COVID-19 vaccines. And maybe I need to allude to the fact that why are we saying the public should continue to take these vaccines because these vaccines are safe? It's because of the fact that when we look at the adverse events that we have received so far in the system, they are quite very few. I think we've got about just over 2,000, and compared to the doses that have been administered so far, which is about 9.5 million as of yesterday, then you realize that the benefits of these vaccines, they actually do outweigh the risk that may be out there. And I believe that Prof will be talking to some of these points more in details. So from my side, thank you very much. I was looking at the time, not providing much information, but I believe that I've provided the most important information that the public needs to know as to how SABRA is ensuring that the vaccines that are available to them, they are of acceptable safety, quality, and efficacy, and how SABRA does continuously monitor the safety of these vaccines. Thank you very much.
Thanks very much. I'm trying to speak again. Let's see how it goes. I think that's all very, very interesting and relevant information. And perhaps we can let Prof take over from here, because obviously your two talks are connected. So Prof Meyer, if you're ready, thanks.
Good afternoon. Thank you very much. Let me just share my screen. I trust you can see my screen now. So thank you very much for this opportunity to share this afternoon with the media and the public out there about adverse events following immunization and the whole reporting and investigation process around it. So it's really been a very topical issue, for the past 3 or 4 weeks. And I think it's very important that, we inform people of what's going on. So as Flora has mentioned, all vaccines, they go through the stages of clinical trials and testing, and that's been done amongst thousands of people. And we know that the 2 vaccines we are using here in South Africa, the Pfizer vaccine and the J&J vaccine, as you can see, there were more than 43,000 volunteers in each of these trials. So people can really feel assured that, when SABRA actually approved these vaccines for use in South Africa, we already knew a lot about the short-term adverse reactions or side effects, as people are referring to them. And these are mild and minor ones. So those are the side effects that we expect to see when we start using the vaccines. So now we are using them in the large population. We are vaccinating large numbers of people of different age groups. We are vaccinating, the elderly. Many people have underlying conditions. So it's not the same population as the population compared to the ones in the clinical trials. So it's very important that we monitor the safety profile of these vaccines. So why are we doing it? And that's why also we are asking people to report adverse events. We want to make sure that the adverse events or the side effects that we are seeing when using these vaccines in the large population, that it's similar to what has been reported in the trials. And like Flora also mentioned, if there's anything of concern, anything out of the ordinary or something serious, then it could be a possible signal, and we need to investigate that. But since the vaccines has been already used in billions of people, you know, they've been shown to be very safe and effective. And we've only seen these very mild and minor events amongst the majority of people. So this is just the vaccine safety surveillance cycle in South Africa. So I don't want to go into detail into this, but people can actually see that this is the process that's been followed from where the vaccine is administered. And then if there is an adverse event, it's reported, investigated, and then causality assessment is being conducted. So together with that, as you can see on the left-hand side, there's also organizations working together with the National Department of Health, and that includes SAPRA, the vaccine manufacturers, ministerial advisory committees, and the World Health Organization. So just to quickly look at what is an adverse event following immunization, and people must really take note of the fact that we call it an event. We don't really call it an effect unless we have shown that it was actually caused by the vaccine. So it's very important to understand is that it could be any medical event that follows immunization, but it does not necessarily have a causal relationship with the use of the vaccine. So it could be a sign, a symptom, a laboratory finding, or a disease. So what's important to note is that when something followed immunization, it does not mean it was caused by immunization. And that is why we need to report anything of concern so that we can actually investigate to see whether it has been caused by the vaccine or whether it has been caused by something else. For example, another health condition that the person might have. Now, what are the adverse events or reactions that we are expecting to see? So they are the mild or the minor ones, as you can see on the screen. So they don't pose a potential risk to the person, and it's part of the body's immune response. So it's also important to note that it's not the same in all people. Some people might experience more events compared to others. Also, some people might experience them more intensely in terms of severity. But these events are mild. They happen within the first couple of hours, and they usually subside within 2 to 3 days, and they hardly ever need any management. So now the question is, should I be concerned about these? When should I be concerned? And when should I report it? So as you can see on the screen, these are mild and minor, and they are common. So in about at least 10% of people will experience maybe a headache or a bit of fever or chills. And then the common ones is less than 10%. That could, for example, be nausea. It's not so common compared to, say, headache and a sore arm and so on. So as you can see, these ones are the common ones, and that's what we expect to see. Now, the more serious ones, or not the more serious ones, but when you are now concerned. So people often say, but what should I report, and when should I report it? When should I seek medical assistance? So that's very important also for people to understand, that you should not assume that all reactions are due to the vaccine. So we are vaccinating now millions of people, and there are many other diseases, conditions happening at the same time. So you could be incubating another, say, infectious disease at the same time that you are being vaccinated. So if these minor events, if they don't subside within the first 2 to 3 days, or if they become more severe, or if there's something out of the ordinary that you are concerned about within the 30 days after vaccination, then you do need to seek medical assistance. So, and that should be done then at a health facility, for example, a clinic or a private practitioner or a hospital or a community health center. Then, as Flora mentioned, there's also the Net Safety app. So that gives the public an opportunity to report these events themselves. So if you feel, you do have an event that you have experienced, it was a concern to you, and you would like to report it, then the Med Safety app is an ideal tool for you to use to report this adverse event. But you feel like, it's a headache, I can take something for the headache, I don't need to seek medical assistance. But if you need medical assistance, you need to go to a facility. If you don't know what to do or where to report, phone the hotline, and then there will be people to assist and direct people to where they need to go, what they need to do. So what kind of adverse reactions are now not expected? So those are the serious and the severe ones. So as you can see here on the screen, they are very uncommon. So less than 1% of people would experience certain severe events or rare events. The rare ones are even less than that. That's less than 0.1%. And the very rare ones is less than 0.01%. So that's basically your chance of experiencing a very rare event. So to give an example of a very rare event is an anaphylactic reaction. So for the vaccines that we are using at the moment, and actually for all vaccines, it's usually around 1 in a million doses. For the vaccines we are using at the moment, there's been various reports. So it could be around 2.5 to 5 in a million people at this point in time. So as you can see, it's still a very, very slight chance. And these very rare events, although they might be severe and they might be serious, they are manageable. So that's why people also need to stay at the vaccination sites for 15 minutes so that they can be observed. So should there be an anaphylactic reaction, it is 100% manageable and there are no after effects. And that is also why, people need to make sure that they take care of themselves, and if there's anything of concern, then they need to report it so that it can be investigated to determine whether it's really an adverse event, caused by the vaccine. So it's all about our risk perception. So what are the real risks? What's your real risk of experiencing one of these rare or very rare events on the one hand? On the other hand, if you decide not to get vaccinated, what is your real risk of getting COVID-19 as a disease? And in addition to that, what is your risk then of ending up in hospital and even worse, dying? So we have seen from the statistics over the last year that the death rate in South Africa has increased, and that also resulted then in a lower life expectancy for people in South Africa. So the risk of dying of COVID-19 is really, it is a very concerning risk at the moment. So if we also look at COVID-19 disease, what we also should be concerned about at this point in time is these after effects of COVID-19 disease itself, talking about long COVID. So there's at least 10% of people experiencing these long-term after effects of the disease. And not a lot is being known at the moment on how to manage these long-term after effects. So risk perception is actually very important. I just want to illustrate it with a couple of pictures here. So, if we drive to the Kruger Park, for example, on holiday, or you go onto a safari, what is your risk of, getting into a dangerous encounter with an elephant, for example. Or if you go scuba diving, what is the risk of your equipment failing? What is the risk of having an encounter with a shark? Also, we are very petrified and scared of an Ebola outbreak. But, also road accidents. We have so many road accidents every day, and that's actually the things killing people in South Africa if we look at all the figures. So the risk that scare people and the risk that actually kill people are very different, and it all depends on how we perceive these risks. So it's important to understand that people not only need to be aware of an existing health risk like COVID-19 at the moment, but they also need to feel personally at risk. So what is the possibility that I might get COVID-19 myself in order for me to take protective reaction? So it's important for us to understand how people evaluate their health risks and how do they gauge their own personal risk, and then how do they react to this kind of information. So now, why do we want people then to report these adverse events? Exactly, so that we can look at these adverse events when they are reported, so that people can know, they are safe when they experience anything. They can report it and it will be investigated. Feedback is then given to people out there. And this is all about maintaining the confidence in the vaccines and in the immunization services. So, all deaths, for example, there's been a lot of discussion about the deaths that followed amongst people who got vaccinated. And none of those deaths up to date have been caused by the vaccine. So they are not related to the vaccine. But death is very serious. So all deaths are considered very serious, and all deaths are investigated. But it's not to say that because they are investigated or because they happened after vaccination, that they were caused by the vaccine. So if we now look at causality assessment, the causality assessment is done by the National Immunization Safety Expert Committee. Just to explain what it means that there's a systematic process taking place where data about these cases are being reviewed to determine what is the likelihood of a causal association between this event and the vaccine. So when looking at the causal association, it means a cause and effect relationship between a causative factor, in this case the vaccine, and then an outcome with no other factors intervening in this whole process. So these events, they are temporally associated, which means the one event occurred after the other event. So say for instance, the adverse event occurred after the administration of the vaccine. So these events, although they are temporarily associated, they may not necessarily be causally associated. In other words, we don't want people to automatically conclude that because this event happened after vaccination, therefore it happened because of vaccination. And that is why we need to investigate these cases and then conduct the causality assessment. So the investigation takes place by multidisciplinary teams within the provinces and the districts. So various healthcare professionals then participate in these investigations depending on the situation. And once they have collected all the information about the case, then this case is submitted to the committee for causality assessment. So when causality assessment is then being conducted by this committee consists of a number of experts, and this committee is functioning completely independent of SAPRA and of the Department of Health, and is a ministerial appointed committee. So they follow a very specific methodology as determined by the World Health Organization, as you can see on the screen, to determine what the likelihood is of the event being caused by the vaccine. And then eventually they provide then the outcomes of these causality assessments and, if necessary, advice and recommendations to the National Department of Health and to SAPRA. Now, when the data is collected for these cases, it's very important to note that detailed information is collected. So as you can see here, the personal details, the vaccine administered, all the information about the event, the dates around the event, the clinical notes, laboratory results, any coexisting conditions, any medication taken at the same time, any possible allergies. And in the case of a death, then there must be an autopsy report and a post-mortem investigation results. So causality assessment can only take place if there is a specific diagnosis for this event. So to get to that point, you need to complete a full case investigation. And then all the details, as you can see on the screen, that's the details that need to be available at the time of causality assessment. I just want to talk a little bit about the process of causality assessment, because people don't really understand how this is done and what actually happens when causality assessment is done. So there's a specific form that's been completed, and this is also being done with specific software from the World Health Organization. So I'm just going to quickly explain. So to start off with this process, as I said, you need to have a valid diagnosis. So if you don't have a diagnosis, you cannot even start off with the causality assessment process. So the case investigation must be done and all the details must be available. And then you go through all these various questions and you determine then, is there any strong evidence that there could be other causes for this event? You also look at the literature and other findings of various studies that's been conducted. Is there any known causal association with this vaccine or with this vaccination? Did it happen within the time window or the time window of an increased risk? So to give an example, an anaphylactic reaction takes place a couple of minutes after vaccination. So if someone reports an anaphylactic reaction 6 days after vaccination, it's not possible because it cannot happen, only 6 days after vaccination. Then you also look at, is there any other evidence against a causal association? And then are there any other qualifying factors for this classification? Any other comorbidities, allergies, any medication that's been taken, and so on. Then also look at the whole process of giving the vaccine, the cold chain, how the vaccine was administered, and so forth. From there on, there's an algorithm to then guide the assessors to arrive at the final classification, and then the vaccine is being, the event's being classified. So, and that can only happen when sufficient information is available. So just to go into the different classes of causal events, then in the end, the way they are being classified. So if there is a causal association, it could either be a product-related reaction. So those are the events that we already know of, that they identified in the clinical trials. For example, swelling at the injection site. If there is a quality-related, defect-related reaction, those ones are being reported by the manufacturers usually. So it's highly unlikely that we will see that. Also in South Africa, we have very stringent regulatory processes, and all vaccines coming into the country or being manufactured here, should it be, as being tested again by the National Control Laboratory. So, so that's why I say those events are it's highly unlikely that we will see them. Then there's also the immunization error-related reactions. So that could, for example, be if a vaccinator used, say, for instance, the wrong needle, or there was a break in the cold chain, then we could have these kind of reactions or events. And then the last one is immunization stress-related response reactions. So those are when people are scared of vaccines, or they are, or immunization itself, or they fear injections, or they fear needles, so they might faint after vaccination. Then there's the coincidental events. So they are inconsistent with causal association. So these events, although they happened after vaccination, they are not necessarily caused by the vaccine. So there could be many other reasons for that. And this is what we are commonly see in South Africa, and also with reference to the deaths that's been reported, where we say they were coincidental. So those were then amongst people, for example, who had many comorbidities. So the death actually took place because of one of those comorbidities. It's also possible that these events can happen, you know, amongst healthy people as well. And it could be, it could also be maybe a new illness that's being identified at that point in time, coincidentally to the vaccination. And for these coincidental events, it's also important to look at the background rates. So in other words, you look at what are the expected rates of a certain event, and then you would compare it and to see if there is an increase in the expected rate of an event or a specific disease. And then that would then indicate that this is a concern, this could be a possible signal. And then this event, Indeterminate, the Indeterminate class. So this is also where we see with adverse events of special interest at this point in time. So where you would, for example, get an event that happened after vaccination, but we don't have enough or sufficient scientific evidence available to say that this event is definitely being caused by the vaccine. Or there could be conflicting trends of inconsistency with this causal association. So these events are then classified as indeterminate, and they could then be potential signals in future or reasons for designing specific studies to further look into these kind of events. And they are also being revisited from time to time. So the causality for these events could then change as new information becomes available. So one example is Bell's palsy. So Bell's palsy could possibly happen after a vaccination. And if it does happen after vaccination, but then there could also be the presence of other conditions, for example, diabetes. So amongst diabetes people, the risk for Bell's palsy is very high. So if those two are then present at the same time, then you wouldn't have enough evidence to say that this has been caused by the vaccine. And in that case would then be classified as indeterminate until we have more evidence available to classify the case. Then the last, category is unclassifiable. So this would be then where a case is totally ineligible for causality assessment. So I've just done an example here where you can see where a case, you receive a case, there's no reported details, the province is unknown, the patient name is unknown or private, the date of birth is unknown. You would, for example, have an age like 75 years and it was a female, and it's a death, the outcome was death, and it happened 14 days after vaccination. So when you have this kind of information, you cannot do causality assessment. You cannot even investigate the case because where are you going to find this unknown person reported by an unknown reporter? This is just to illustrate to people the importance of making sure that you make information available so that the case can be traced and investigated. Then also a case could be unclassifiable when you do proceed with the causality assessment, but in the end, you don't have sufficient information available to classify the case. So there could be very important information that's outstanding or not available, like a laboratory result or an autopsy report. So finally, the message is that, you know, people should seek medical treatment when they are experiencing any symptoms of concern. And shouldn't assume that these symptoms are reactions due to the vaccine. So it is possible that you could be incubating another illness, for example, a very high fever. Maybe you visited a malaria area, coming back, get your vaccine, and now you present with high fever. And you assume this is only being caused by the vaccine, especially if this is now persisting. And then eventually this person could get very ill, and even it could result in death. And then it's because of the malaria, but not because of the vaccine. Also other conditions, tuberculosis, pneumonia, many other conditions. People could also be having underlying COVID-19 infection, because at the moment, COVID-19 is circulating at very high rates. So it is possible. It's very important to immediately report all severe events or anything of concern. And the question is, are these COVID vaccines safe? And the answer is yes, they are safe. So I think Flora also mentioned it now, with more than 9 million doses being administered in South Africa, the reports of adverse events received was only 0.02% of reports that's been received at this point in time. So it just illustrates, you know, how important it is to look at your perception. What is the risk of experiencing an adverse event compared to the real risk of getting COVID-19 and then dying of COVID-19? So thank you very much. I just acknowledge everybody who's worked very hard in you know, setting up the whole surveillance system for South Africa, specifically for COVID-19, and then also, you know, looking at all the adverse event, all the members from the National Immunization Safety Expert Committee. So thank you very much, and it would be good to answer some questions. Thank you.
Many thanks to Professor Hanneli Meyer, who is an expert in immunization activities in the national effort to fight COVID-19. In the interest of time, I'm going to move through to our next speaker, who is Ponzo Pilani. Ponzo is a journalist from Health eNews, who can share with us some of the issues that she picks up on the ground as someone who's out there and has an opportunity to engage with the public on issues pertaining to health, but particularly COVID-19. Over to you, Ponzo. Before I actually hand over to Ponzo, I would just like to make an announcement to all our media colleagues on this platform that we'll be taking questions, although not all of them in the interest of time, questions that were posed through our chat. You can post your chat there. Please identify yourself, as we won't be able to take questions from anonymous. But at the same time as well, our colleagues from GCIS have assured us that the presentations will be shared and emailed as long as you drop your email address on the chat box. I'll sponsor over to you, please.
Thank you, Musidi. And just for correction there, I'm no longer at Health eNews, and I'm a freelance health journalist. Particularly right now, I've been working with Motsweding FM with the morning radio show, where for about 6 to 10 minutes every morning, I explain the latest developments of COVID-19 in Setswana. And the reason that this segment was started over a year and a half ago, when the pandemic was settling, or when the pandemic was starting in South Africa, was because we realized that there was a dearth of information, particularly in our indigenous languages, in South African local languages. And with speaking to the producer of the morning show, we saw that it was important. However, when we talk about vaccine hesitancy, and this morning we were present, some of us were present at the press briefing about the surveys that show vaccine hesitancy and acceptance by the Center for Social Change at the University of Johannesburg, as well as the Human Sciences Research Council. And you know, some of the key findings, they give us light or shed some light into the very important reasons why we're seeing some vaccine hesitancies or some questions, or the slow uptake to register and go for the vaccine. And I'll also just give some anecdotal evidence, or some of the things that people on social media, through Mutwedding FM, and on my own personal account are saying what is the problem. But we saw, just to recap, that, you know, the fourth round of these surveys showed that vaccine acceptance has increased, and that in fact it is older people who are more receptive to the vaccine now, as compared to these issues around with the young people, as the rollout for 18 to 34-year-olds is about to begin. And so these are some of the questions. However, we need to also realize that when information is not available in accessible ways, for example, we are having this webinar in English. And of course, we can say that English is a universal